So hey everyone, welcome to CoreVet. So today in this particular video lecture, we'll be discussing about the quinolones or the fluoroquinolones. Okay, so if we talk about the quinolones, so this particular class of drug is quite different in terms of the mode of action as comparison to the other classes of drug we had discussed in our previous lectures, right? Because we do know that we had studied regarding the drugs that some were inhibiting the cell wall synthesis, some were inhibiting the protein synthesis, right? Likewise, your penicillin, cephalosporin were inhibiting the cell wall synthesis, right? But your tetracycline, chloramphenicol, or macrolides all were inhibiting the protein synthesis, and some were inhibiting the intermediary reactions like your sulfonamide and trimethoprim, right? But this particular class of drug is having quite a different mode of action. It is having a different mode of action, okay, that we will discuss. That this particular class of drug inhibit the DNA gyrase and topoisomerase 4, okay, that we will discuss in our mode of action. Okay, so let's just begin with the general information regarding the quinolones. Okay, so if we talk about the general information regarding the quinolones, so maximum of the points we had already discussed. See, if you just remember all the points from the general chemotherapy part 1 and the part 2, then you can write many of the general information regarding all the classes of the drug that you had studied, right? Likewise, in the very first lecture, we had discussed that the fluoroquinolones show what? The concentration dependent killing, right? What does it mean? It means if you increase the amount or the concentration of the fluoroquinolones, it will be more effective against the bacteria. Okay, so the killing property will be going to increase if you are going to increase the concentration of the fluoroquinolones. Okay, likewise, we had already discussed about the post antibiotic effect also, that the fluoroquinolones show what? The post antibiotic effect, right? We also had discussed while we were discussing regarding the spectrum in the classification that the quinolones comes under what? The broad spectrum drugs, right? And they do show the bactericidal effect, right? And if we talk about the discovery of these quinolones, so they were discovered in the 1962 with the introduction of 8-azoquinolone nalidixic acid. Okay, and from the nalidixic acid, when there were made the modification in the structures of the nalidixic acid, the norfloxacin, ciprofloxacin, and some other drugs were found. Okay, if we talk about the prototype, okay, so the oxalonic acid is the prototype and the very first quinolones. Okay, it was the first quinolones and the prototype of this particular group, right? If we talk about which drug was the firstly going to be approved for the animal usage, it was the enrofloxacin, and the norfloxacin was the first approved quinolones for the human usage, right? You should remember that the enrofloxacin, it is quite famously also used in the veterinary, right? So you should remember that the enrofloxacin was the first approved fluoroquinolones in the animal medicine, right? So moving towards the classification, so there are four generation of the fluoroquinolones that you had to study, right? From the each generation, you can just remember 4 names. Okay, I had written many of them. You can just pick any of them, okay, any 4 of them to write a descriptive answer in your examination, right? Because the classification do come for in a descriptive answer, so you can just remember 4 of them from the each generation. Okay, if we talk about the very first generation, it is the monocyclic derivative, right? Then the second generation is a bicyclic derivative, third generation is the tricyclic, and the fourth generation, as the name suggests, it is the quadricyclic derivatives. If we talk about the first generation, so the very famous are the nalidixic and the oxalonic acids, right? Then it's your flumethrin, then cyanoxacin, right? Rosoxacin, pyromidic acid, and the pipermidic acid. These all are effective against the gram-negative mainly, right? So the next generation, which is the second generation, it comes along with the ciprofloxacin, your enoxacin, fluroxacin, lomofloxacin, natifloxacin, norfloxacin. See, the suffix all are having the suffix floxacin mainly, right? Or oxacin. There are 2 suffixes that you should remember. Okay, then your ofloxacin, pefloxacin, and trufloxacin. These all drugs comes under the second generation, right? If we talk about the third generation, so third generation have the belofloxacin, gripafloxacin, levofloxacin, moxifloxacin, pazufloxacin, sparfloxacin, tamofloxacin, and tosufloxacin. Okay, in the fourth generation, we have the clinafloxacin, your gamifloxacin, sitafloxacin, trovafloxacin, prulifloxacin, and gatifloxacin. See, there are several names. You can just remember four from the each generation, okay, to just write a descriptive answer, because it is quite hard to just remember all the names to write a descriptive answer in your examination. You can just remember four of them, okay. If we talk about the drugs that are famously used and approved in the usage in the veterinary, so the enrofloxacin, morbifloxacin, danofloxacin, obifloxacin, pradofloxacin, sarfloxacin, and your ibafloxacin and diflofloxacin are approved for the usage as a fluoroquinolones in the treatment of the animals. Okay, so let's start with the mode of action. Okay, so starting with the mode of action, so first of all, let me discuss regarding the base first, because it is quite important to just clear the base first before starting the mode of action. Okay, so in your schooling you must have studied about the topoisomerase enzymes, right? Okay, you must have studied these enzymes while understanding the replication, okay, in your school time, right? So there are four type of topoisomerase: type 1, type 2, type 3, and type 4. Okay, so the type 2 topoisomerase is also known as DNA gyrase. Okay, in some textbook it is mentioned as the type 2 topoisomerase directly, and in some textbooks it is written as the DNA gyrase while explaining the mode of action of the fluoroquinolones. Okay, so you should remember that both are same, that the type 2 and DNA gyrase are similar. Okay, so while understanding the mode of action of the fluoroquinolones, you should be clear that the prime importance while understanding the mode of action of the fluoroquinolones, the type 2 or the DNA gyrase and type 4 are quite important. Okay, so those two enzymes are quite important while understanding the mode of action, which is the DNA gyrase, right, and the type 4 topoisomerase. Okay, so let me start by discussing regarding the functions of these particular enzyme. Okay, we will discuss regarding that how the type 2 and type 4 topoisomerase, what the function of these two enzymes in the DNA replication and DNA transcription. Okay, so starting with the DNA gyrase, right? So we all know that DNA is quite a complex structure. Okay, it is quite a complex structure which is arranged in a compacted form inside a cell, right? We all know that there's a quite a bigger structure which is arranged in a compacted form within the cell, right? But we do know that during the DNA replication and the process of the transcription, right, we do know that this is in the winded form, right? This is in the winded form because it is quite congested. Okay, it is in the winded form. The DNA is it should be firstly opened up, right? Opened up, right, means unwinding of DNA should be made before the DNA replication or the process of the transcription. So what happened? See, look over here. So this is your DNA. This is your DNA. We all know that during the replication and the transcription, there is an enzyme which is known as helicase, which is going to open the the DNA strand or widening the strand in order to in order to perform the process of transcription, as well as in the process of DNA replication. In both the process, the DNA should be opened up first, right? So what happened during the opening up? There is a creation of a stress below, right? How to understand this particular segment? See, open over here. So we all know, see, take a thread, right? If you take a thread and when you are going, see, you had rolled, what you had done, you had rolled the threads, right? You have rolled two threads, right? You have rolled two threads, right? But when you're going to open up the two threads, see what happened? A creation of a strain or stress would be there on the what threads, right? Whenever you are going to open up the threads, see, that's how the strain would be there, okay, in the strands. Whenever you are going to open up this threads, there would be a creation of a strain inside the your thread, right? So in this similar fashion, when the helicase is going to open up or unwind the structure of the DNA, it will create a stress over there, right? Okay, it will be going to create a stress below in order to create a tension in the DNA strand, which may lead to a breakage in the DNA strand, right? So what's the purpose of the DNA gyrase? Is it will introduce a negative supercoiling, okay? It will introduce a negative supercoiling in order to have a reduction in the strain that is created in the DNA, right? So that's the purpose of the DNA gyrase, to just introduce a negative supercoiling in order to just reduce the stress or the strain in the DNA in order to prevent any sort of breakage in the DNA, right? So that's what the purpose of the DNA gyrase is, right? I hope it is clear. So I will just again tell you regarding the concept of the strain, that just roll out two thread, right? Take two thread and just roll them one upon another, right? Just try to reopen that particular strain thread, okay? Just try to just reopen that particular thread, right? When you are going to reopen that particular thread, what it will lead to? It will lead to creation of a certain strain in the threads, right? So in the similar fashion, what happened that when the helicase is going to open up the strand or going to unwind the particular strand, it will lead to a creation of a stress in the DNA, right? So to prevent that particular stress, there is DNA gyrase, okay, which introduce what? The negative supercoiling, right? To just release the stress, right? That is created due to the unwinding of the DNA structure. Okay, so that was the purpose of the DNA gyrase. Okay, I hope this particular function of the DNA gyrase is clear to you, right? So let me just discuss regarding the topoisomerase 4. So before starting, we all know that if there is a mother bacterial cell, okay, mother bacterial cell, right? So it will lead to formation of what? Two daughter cell. And these two daughter cell will have a equal proportionate of nuclear content, right? So for that, we all know that DNA replication is done, right? So what happened after DNA replication? Consider this blue DNA, okay? This blue DNA is from what? The mother side, right? Mean the mother bacterial cell was having the blue DNA, right? So after replication, what happened? A similar structure of the DNA has been formed, which is depicted as an orange over here, right? Means the blue DNA was the DNA which was of the mother bacterial cell, right? And after the replication, the orange DNA structure that is there, which is similar to that of the blue, it is depicted as the orange over here to just differentiate between the replicated and the non-replicated DNA segments, right? So the orange one is the replicated DNA strand, right? Now after the replication of the DNA has been done, so these two particular DNA structures, one which is the replicated and one which is the from the mother bacterial cell, both are catenated together or joined together, right? Both the DNA are being joined together after the replication, okay? But obviously these two DNA should be getting separated in order to just divide them into the two daughter bacterial cell, right? And that process is known as decatenation. Means just separating the two DNA from each other in order to just equally distribute the DNA content into the daughter bacterial cell, right? And that process is known as the decatenation. Okay, so after the decatenation, both the DNA is going to be just separated from the each other, right? Earlier it was the catenated in the catenated form. After the procedure of the decatenation, these particular strands of the DNA is getting separated, and each daughter bacterial cell will be receiving one of them, right? It is clear. So this particular decatenation process is done by what? It is done by topoisomerase 4 enzyme, right? Now I hope that you are much more clearer with the action of the DNA gyrase and the topoisomerase 4, right? Now what's the purpose is? How the mode of action of the fluoroquinolones and the quinolones is being made, right? First of all, we are clear that DNA gyrase, what it will be going to do? It will be going to introduce a negative supercoiling, right? It is going to introduce the negative supercoiling. And what's the topoisomerase 4 is doing? It is going to perform the decatenation, right? To just separate the DNA structures after the replication. There is one more point, that there are two units in the DNA gyrase. One is the A subunit and second is the B subunit. Okay, so the A unit is responsible for the formation of the nick in the DNA strand, right? It is responsible for the formation of a nick in the DNA strand, and the unit B is responsible for the introduction of the negative supercoiling, right? So the B is responsible for the introduction of what? The negative supercoiling, and the A unit is responsible for the formation of a nick in the DNA strand, right? So we are clear with the functions of the DNA gyrase and the topoisomerase 4. Okay, so let's just move towards the mode of action. So it's the same thing that I had told you, that there is bacteria have what? The bacteria have DNA gyrase enzyme and type 4 topoisomerase, right? DNA gyrase is also known as what? Topoisomerase second, right? So what's the function? It is going to carry an energy dependent reaction, right? How it is going to form? It is firstly going to form a nick, and then it will be going to introduce a negative supercoiling, and there will be resealing of the nick after the either the process of the transcription or the DNA replication. Okay, so what's the purpose of the DNA gyrases? It is quite important in the process of the transcription of the genes. During the DNA repair also, the DNA gyrase, obviously if there is a damage in the DNA, obviously we have to just open up the DNA first, okay? And if there is any sort of opening in the DNA, then there would be the function of the DNA gyrase in order to introduce a negative supercoiling, right? And during the recombination process also, the DNA gyrase play a crucial role. Okay, so in the DNA gyrase there are two subunits, the subunit A that I had told you and the subunit B. So what's the purpose of the subunit A is? So the subunit A was responsible for the formation of a nick in the DNA strand, I had told you, and have a cutting function, right? And it is also the primary site for the action of the quinolones, right? If we talk about the B subunit, it is going to introduce a negative supercoiling in the presence of a ATP hydrolysis, right? I hope this particular part is clear to you, right? Now coming on to the mode of action, so what happens? So first of all, the fluoroquinolones is going to enter the bacteria, right? After that, I had told you the fluoroquinolones is going to bind at the target site is what? A subunit, okay? And it will lead to the what? Inhibition of the DNA gyrase enzyme, right? If there would be the inhibition of the DNA gyrase enzyme, there won't be any negative supercoiling, okay? If there won't be any negative supercoiling, there will be excessive strain, right? And due to the excessive strain, there will be what? Certain breakage in the DNA, as well as the nicks that has been formed by the A subunits, okay? It is not going to be resealed, right? If the nicks is not going to be resealed, there would be disintegration of the DNA fragments, right? Okay, so the fragments would be going to be disintegrated, right? And there would be also an action of the exonuclease there, right? So you can see over here the formation of the nick was there, right? And after during the in presence of the DNA gyrase, you can see there would be an normal DNA replication, right? But if the DNA gyrase is going to be inhibited, there would be no resealing, right? If there would be no resealing, it will lead to the fragmentation of the DNA, right? Because the negative supercoiling is not going to be introduced, right? Resealing would be not there, right? And there would be also action of exonuclease, right? So that's how the fluoroquinolones is going to affect the DNA replication, transcription, recombination, and several function. Means the DNA function is going to be inhibited by the action of the fluoroquinolones. And after that, if the fluoroquinolones can also act on what? The fluoroquinolones can also act on topoisomerase 4, right? If the fluoroquinolones is going to act on the topoisomerase 4, what it will lead to? It will lead to inhibition of the decatenation process, right? Means the DNA that has been replicated from the mother bacterial cell is not going to be detached from the original DNA, right? If there won't be any detachment of the original DNA, obviously the daughter bacterial cell won't be getting any sort of DNA or the nucleic acid, right? And it will lead to the hindrance in the replication and the multiplication, right? So that was all about the mode of action of the fluoroquinolones, that there was two enzyme of main concern, the topoisomerase 2, topoisomerase 4. The topoisomerase 2 was responsible for the introduction of the negative supercoiling in order to just reduce the strain that is there in the DNA during the replication or the transcription process. Okay, so the fluoroquinolones is going to just inhibit that particular DNA kyrase enzyme, which will lead to what? Which will lead to the inhibition in the negative supercoiling. If there would be the inhibition in the negative supercoiling, it will lead to what? It will lead to the fragmentation of the DNA, right? Because there would be an excessive strain, and also there won't be any resealing of the nicks, right? That's why there would be what? There would be an inhibition in the DNA replication or the transcription. In the similar fashion, there would be an inhibition of the topoisomerase 4, which will lead to the inhibition of the decatenation process, right? I hope this particular mode of action is clear to you all, right? So talking about the antimicrobial spectrum of the fluoroquinolones, so the first generation is quite effective against the gram-negative bacteria, I had told you. If we talk about the second generation, they are quite effective against the gram-positive, gram-negative, mycoplasma, chlamydia, E. coli, salmonella, campylobacter, shigella, brucella, and the vibrio. Okay, these all are susceptible towards the fluoroquinolones. Okay, it is also effective against the pseudomonas aeruginosa and staph. Okay, but strepto, okay, tends to be resistant against the most of the fluoroquinolones. Okay, so the streptococcus is quite resistant against the fluoroquinolones. Discussing about the pharmacokinetic property of the fluoroquinolones. So first of all, we all know there is what? Absorption, distribution, or metabolism, and the excretion. Talking about the absorption, so generally this particular fluoroquinolones are given through the intramuscular and the subcut route, as there is rapid absorption through these routes, and it is also given orally in the monogastric animal and premature calf, but not in the case of the mature ruminants, due to the what? There is presence of a rumen in the ruminants, right? In the premature calf, obviously the rumen is not that much developed. Okay, the microflora is not that much developed. That's why there the oral absorption of the fluoroquinolones is good in the premature calf, right? But in the case of the mature calf, the rumen is already developed. The microflora is there in the rumen. It will lead to the degradation of the fluoroquinolones itself in the rumen, right? That's why it is not prescribed, that the oral route is not prescribed for the mature ruminants, right? And the bioavailability we talk about in the case of the monogastric, it's about the 80%. Okay, so in the similar to the tetracycline, there are two features, that the food delays the absorption, and the calcium and the magnesium delays absorption when given the orally, because it will lead to the chelation. Likewise in the tetracycline. Okay, so the calcium and the magnesium salts are going to just chelate the fluoroquinolones and decreasing the oral availability of the fluoroquinolones. If we talk about the dogs, cats, and the pigs, the absorption of the fluoroquinolones is near about 100%. Okay, so in some animals there is delayed absorption, okay, through the IM and the subcut route. Okay, if there would be a delayed absorption, obviously there would be a longer half-life. Okay, as comparison to what? Administration. See, in the IV administration, obviously you are going to just inject the particular drug into the vein itself, right? You are going to just inject the drug into the veins, right? It will have a direct bioavailability into the circulation, right? You are just injecting a drug into the circulation directly, right? But in certain cases, what we had observed that the through the IM route and the subcut route, what happens that there is what? Delayed absorption, right? Due to the delayed absorption, there is a longer half-life, right? It is also known as what? Flip-flop kinetics, right? Means the rate of absorption is lower than that of the elimination, right? Talking about the distribution, so if we talk about the distribution, so it is distributed through all the tissues, okay, and the body fluids, also in the CNS, bones, skin, and the prostate gland, right? And there is also an accumulation likewise that is in the macrolides. They do accumulate in the macrophages and the leukocyte and highly effective against the intracellular microbe. Okay, so the plasma protein binding affinity varies from the 10%, which is for the norfloxacin, to the 90%, which is for the nalidixic acid. Okay, nalidixic acid is quite famously used in the UTI infections also, UTI infection, right? So if we talk about the concentration of the fluoroquinolones in the cells like macrophages and the neutrophils, it is 4 to 10 times higher than the plasma concentration. Means they are quite concentrated inside the cells. Talking about the metabolism and the excretion, so the ofloxacin is eliminated unchanged form. In the unchanged form, if we talk about the enrofloxacin, we are going to give the enrofloxacin. It is going to convert to the ciprofloxacin in the body, right? Ciprofloxacin, right? And what happened, by which process this particular enrofloxacin is going to convert to the ciprofloxacin? It is going to metabolize inside the liver by the process of the ethylation, okay, deethylation. It is going to transform by the process what? Of the deethylation, right? So the enrofloxacin is going to convert to the ciprofloxacin inside the liver by the process of the deethylation. Talking about the pefloxacin, it is going to be completely metabolized, and the difloxacin is undergoing what? Demethylation. The enrofloxacin was undergoing deethylation, while the difloxacin is going under demethylation to form what? Sarafloxacin. If we talk about the ciprofloxacin, it is partially metabolized, okay, and the cefloxacin is eliminated in the unchanged form as that of the ofloxacin, right? Talking about the pefloxacin, it is a methyl derivative of the norfloxacin, right? If we talk about the route of excretion, so renal route, it is a major route of excretion or elimination for the fluoroquinolones, and the alkaline urine will increase the renal tubular absorption of the fluoroquinolones and leading to the what? Increasing the half-life. So if you want to just increase the half-life of the fluoroquinolones, you can use the urinary alkalizers, right? If we talk about the half-life of most of the fluoroquinolones, it's about 3 to 6 hours, okay? But you have to remember that fluoroquinolones do not excreted in the lactating animal. It is a point to remember. So if we talk about the adverse effect now, so what happened, the fluoroquinolones at higher doses, what they do, they just lower the threshold value for the induction of seizures and convulsions. Means the value, there is a certain value in the body at which the seizures and convulsions occur, right? But what happened when you are going to give what? When you are giving the higher doses, right? Whenever you are giving a higher doses for the fluoroquinolones, what happens? There is an induction of seizures and convulsions. Okay, why? Because threshold value for the achievement of the seizures and the convulsions is getting reduced. Means earlier at a certain value, at a certain high value, the seizures can be achieved. But what happened when you are going to increase the fluoroquinolones dosage, right? It will lower the threshold for the induction of the what? Seizures and convulsions, right? And they may produce the crystal urea in the dogs due to the low solubility in the acidic urine. I had told you that for the increasing the half-life of the fluoroquinolones, you can give the urinary alkalizers, right? And hypersensitivity reaction with the chances of low degree in the animal. Means the hypersensitivity is quite not there in the cases of the animals with the fluoroquinolones. But what's the most important thing is that the joint arthropathy is there in the young growing animals. Okay, in the dogs generally which are less than 7 months of age or equivalent to the 7 months of age, this particular condition, which is the joint arthropathy, could be seen in the cases of the dogs, right? But it is not seen in the cases of kitten, calves and the pigs, because they are resistant to this particular conditions or the adverse effect on the application of the fluoroquinolones, right? So the joint arthropathy is quite a famous adverse effect for the cases of the fluoroquinolones. You should remember this particular segment, that the joint arthropathy is caused by the fluoroquinolones in the cases of the young animal, especially in the cases of the dog, but there are certain species like the cats, your ruminants and the pigs which are resistant to this side effect of the fluoroquinolones, right? Why this particular joint arthropathy is happening? Because in animal nutrition you must have studied that magnesium is quite responsible for the proper development of the cartilage matrix, right? So what happened, there is a chelation, the fluoroquinolones chelate magnesium ion, right? If the fluoroquinolones is going to chelate the magnesium ion, obviously there would be what? Magnesium ion deficiency, right? There would be deficiency of the magnesium, but the magnesium is quite important for the what? For the development of the cartilage matrix, right? If there won't be any development of the cartilage, obviously the articular surfaces won't be that much good, right? So what happens during the joint arthropathy, there will be toxicity in the chondrocytes, right, which will lead to the formation of a vesicles and in the articular surfaces. Why it is happening? It is happening due to the chelation of the magnesium ion, which is quite important for the development of what? The cartilage matrix, right? And generally the young one are quite prone to this particular toxicity. Why? Because they are in the developing phase, right? The cartilage is forming in this individuals, right? Young ones are forming the cartilage, right? So that's why this particular toxicity of the joint arthropathy is seen in the young one. Okay, so the chelation of the magnesium ion result in the local magnesium deficiency. Obviously, if the fluoroquinolones is going to chelate the magnesium ion, there would be the deficiency of the magnesium ion, right? It will lead to what? It will lead to loss of the proteoglycan in the articular surfaces or the articular cartilage, right? It also lead to the hemolytic anemia, and there is a retinal dysfunction also in the cats. So the enrofloxacin shouldn't be prescribed in the cats, right? Because there is a retinal dysfunction, right? So in the cases of the cat, there is blindness which is observed, right? Okay, due to the changement in the retina. Okay, so the retinal dysfunction is also a quite famous adverse effect in the cases of the cats. So that's why the enrofloxacin isn't given to the cats. Okay, if we talk about the sequence for the retinotoxicity, it's the orbifloxacin which is the most toxicity, then the marbofloxacin and the prodofloxacin, right? Coming on to the drug interactions. So if we talk about the drug interactions, so nitrofurantoin, which is also used in the UTI infections, it impairs the efficacy of the quinolones if used concurrently for the UTI infections, right? And in the combining with the other antibiotics, okay, it neither antagonize or nor enhance the activity of the fluoroquinolones. Means if you're going to just mix up two certain classes of the drugs along with the fluoroquinolones, it's not going to affect the efficacy of the fluoroquinolones. Okay, won't be increasing the activity of the fluoroquinolones, neither it won't be antagonizing the activity of the fluoroquinolones. Okay, if we talk about this particular point that we had already discussed, that the calcium, magnesium and trivalent cations along as well as the antacid, as similar to the tetracycline only, if they will lead to what? They will lead to the chelation of the fluoroquinolones. Obviously it will lead to the inhibit the oral absorption. That's why they are not given with the food, right? Or even with the milk supplements, because they are rich in the calcium, magnesium ion, right? If we talk about the probenecid, it blocks the tubular secretion of the fluoroquinolones and increases the half-life of the fluoroquinolones, similar to penicillin. Okay, In the penicillin also we have seen the action of the propenicid on the tubular secretion, and it is similar to what? Similar to tetracycline, right? If we talk about the quinolones, they inhibit the metabolism, okay, of the theophylline, resulting in the prolonged and potentially toxic level. Obviously, the metabolism of a certain drug is going to be inhibited by a certain drug. It will lead to the accumulation of that particular drug inside the body, ultimately lead to an achievement of the toxic level. So the fluoroquinolones, when they are added up with the NSAID, it will lead to what? It will lead to increase in the potential of the fluoroquinolones to lower the threshold value for the seizures, right? I had told you that at a certain value, or this has certain threshold, the seizures occur, right? But if certain drug is going to reduce that particular seizure threshold, it will lead to what? It will lead to the occurrence of the convulsions at much lower threshold values, right? And if we talk about the clinical uses, the naldexic acid, I had told you these are used in the UTI infections, so it is used as an urinary antiseptics. These are also quite effective against the respiratory tract infection, UTI I had told you, in the skin infection, prostate gland infection, external and middle ear wounds, okay, if there is an ear wounds, these drugs can be prescribed, and oral cavity infections could also be treated by the fluoroquinolones. These are also used in the treatment in the meningoencephalitis, osteomyelitis, and the arthritis, okay, because the tissue penetration of the fluoroquinolones is quite good, right? And if we talk about, these are also effective in the local and the systemic infection, okay, and quite effective against the intracellular bacteria also, because they have ability to just concentrate within the macrophages and the neutrophils. And these could also be used for the treatment of the rickettsial infection, and also in the Escherichia canis infection, right, in the canines. And we had told you that the doxycycline is quite famous for the treatment in the Escherichia canis, okay. So this was all about the fluoroquinolones. So thank you everyone.